Almost time here. If you could take your seats, it's almost 7:15. Thank you. Good evening. Welcome to part 2 of our educational forum tonight. I'm Karen Urbano. I'm president of the League of Women Voters of Woodland. We have an educational presentation taking no sides for Proposition 1. You'll get lots of information about it. Proposition 1 authorizes $6.38 billion in bonds to build mental health treatment facilities for those with mental and substance abuse challenges and provides housing for the homeless. It's a legislative statute. The presentation will include information. What is a proposition? But you probably already know that. How it is on the ballot. A history of the proposition known as the Mental Health Services Act. What Proposition 1 would do. What a yes or no vote on Proposition 1 means. Who supports and who opposes Proposition 1 and what they say. Janet Ruggiero will begin the presentation.
Good evening. It's exciting for all of you to be here in a wet evening, so thank you for being here. I'm going to go through some questions just to help you as you start to look at Prop 1. First of all, you probably all know what a proposition is, but in California, a ballot proposition is a referendum or an initiative measure that is submitted to the electorate for a direct decision or a direct vote. If passed, it can alter one or more articles of the Constitution, one or more of the 29 California codes, another law that's been in the California statutes, or it clarifies, correct, changes statutes, or removing current statutes. This proposition amends the Mental Health Services Act passed by the voters in 2004. I'm sure you all remember that proposition in 2004. And it also includes a bond measure which requires the vote of the people for any bond in California. How did it get on the ballot? Measures can be placed on the ballot either by the California State Legislature or via a petition signed by the registered voters. Prop 1 was placed on the ballot by the state legislature. In order for it to pass, it just requires a majority vote. So how should we evaluate ballot propositions? The League of Women Voters of California has put together a pros and cons on Prop 1, which we're going to pass out to you at the end of the meeting. But in that short pros and cons, it talks about what we should be looking at in ballot propositions. We should examine the measures to find out what it accomplishes. Do you agree with the goals of the proposition? Is it consistent with your ideas about government? Will the changes make it better? Who are the real sponsors and the opponents? Check where the money is coming from. And in the pros and cons, in the pros and cons, they give you a way to access where the money is coming from. So if you want to look that up, you can do so. Is the measure written well? Does it create conflicts? Is it good government or more problems? Does the measure create its own revenue source? Does it earmark, restrict, change, or obligate government revenues? Does a measure mandate a government program or service with addressing how it will be funded? Does the measure deal with one issue that can easily be decided by a yes or no vote? Or is it a complex issue that should be examined in the legislative arena? And in this proposition, the legislature has done that by bringing it to you as a voter. Be wary of distortion tactics, commercials that rely on image but tell you nothing about the measure. Beware of half-truths. So think about those as you listen to the conversation tonight about this proposition. And we're going to give you a little history of Prop 1, especially as it relates to the Mental Health Services Act, passed in 2004. It's known as the millionaire tax. It's a 1% tax on personal income over $1 million. So anyone here pay that? No, just checking. So 95% of these funds are granted to the counties, which provides for relative flexibility in their use for mental health services and for substance use treatment for people with or at risk of developing mental health illnesses. The MHSA provided funding for the expansion of mental health programs within the community and developed new and innovative programs to fit the needs of the county with a focus on the underserved populations. The Act has evolved over the years. It has sometimes been used to maintain current levels of service because it has been the only source of stable funding. Actual funding adjustments are based on how many millionaires we have in California, and this adjustment actually increased during COVID shutdown when millionaires did quite well. The tax has generated an estimated $26 billion for county mental health services. Last year, the tax garnered more than $3 billion and supports 1/3 of the state's mental health system. The other source of revenue that counties look to is Medi-Cal, and it spends a portion of its general fund on mental health programs, but with strict spending limitations. In Yolo County, they recently adopted the 23 to 26 MHSA plan. It's regulated by the California Code of Regulations, and they just completed the adoption of their plan. There are 21 funded services they will provide for Yolo County, which is included in the plan. The plan was completed after extensive public outreach and input on what the plan should be doing for county residents. Now, the passage of SB 326 and AB 531 is the combination of legislation that brings you Prop 1. SB 326 renames the MHAS Act to the Behavioral Health Services Act. And AB 531 seeks a housing bond in the amount of $6.4 billion to build behavioral health treatment, residential care settings, and permanent supportive housing, with a portion of the funding earmarked to house veterans at risk of experiencing homelessness. So what would Prop 1 do? It's a two-pronged position, includes the $6.4 million bond to build 6,800 treatment units for mental health and substance use disorders. That's $4.4 million of the proposed bond. At least $1.5 billion is to be given to local governments and tribes. The second part of Prop 1 is to build or renovate 4,350
supportive housing units for the homeless, or at risk of homelessness, or who have mental health or substance use disorders, of which half of the money is for veterans. Part of this would turn hotels, motels, and other buildings into housing, and the other part would construct new housing. To give you an idea, in January of 2022, approximately 171,500 Californians were homeless. And they're currently, you've probably seen in the news, they're now doing the homeless count right now throughout the state of California to give us an idea of what it's like in 2024. Of this population, 75,700 are suffering from severe mental illness and or chronic substance abuse. Another 10,400 are veterans. The other thing Prop 1 would do would shift approximately $140 million of annual MHSA funding from counties to the state for its mental health services. This is a 5% loss from counties to the state for its mental health services. By diverting 1/3 of all the county MHA funding for mental health services to housing, so this would require the county to take 1/3 of the money it was getting and now put it into housing and personalized support system such as an employment assistance and education. Including in this is other changes in how the money of the MHSA was allocated. They want larger target populations under a new expanded concept of behavioral health. The definition is not quite clear. There's a couple of areas of definition. Provide impacts on prevention and early intervention services, and now specifies that you can only use 17.5% of the funding, providing flexibility and innovation at the local level in terms of what counties were doing with the money to meet its needs. Lastly, let's talk about the fiscal impacts of Prop 1. First of all, for the MHSA. More MHSA money is to the state, less to the counties. Counties will have to use a greater percentage of their MHSA funding for housing and support for services, and less for county community-based mental and behavioral health treatment. Possible increased costs to counties to continue their current programs. They would have to use other county, state, or federal money to keep their current service levels that they had originally from the MHSA money. So if they want to keep those service levels, they'll have to find other funds to do it. There's a bond attached to Prop 1, as I talked about before. This would increase the state costs of $310 million annually for 30 years to repay the bond. LAO, which is, and I'm forgetting the name, but give me a minute. Thank you. Legislative Analyst's Office estimates the cost to repay the bond would be about $310 million annually over a 30-year period, but you have to also add in the cost of the interest rate when you're looking at the repayment. So it could be several more billion to repay the bond. Funding for local governments. The question is, how would the bond impact the shortage of places for mental health and drug or alcohol treatment? Local governments and tribes would receive grants and loans to build more places for mental health care and drug or alcohol treatment, and more housing for people with mental health, drug, and alcohol challenges. governments would have to pay for some of the cost to operate these places and the housing. The bond is estimated to build places for 6,800 people to receive mental health care. But even after you've expended all the money of the bond, you would still need more new places after the funds are spent. So how would the bond impact homelessness? And these are all from the LAO, the numbers that I've been giving you. They estimate the bond would build up to 4,350 housing units, 2,350 for veterans, would provide housing to over 20% of the veterans now experiencing homelessness, and reduce overall homelessness by only a small amount. So that's just to give you the background of Prop 1. As I went through it, I realized it's a lot of information, but I tried to break it down into areas to help you understand it. And we're now going to hear from Pat, who's going to talk about the pros for the proposition.
Good evening. Now I'm going to give you the arguments in favor of Proposition 1. Why does California face a humanitarian crisis of homelessness, mental illness, and substance abuse? Well, our mental health system is broken. It goes back to the closure of the state's mental health hospitals in the 1960s and 1970s, when politicians dumped tens of thousands of patients into our communities and failed to provide alternative services to fill the gap. Mental health treatment has been underfunded for decades, and the COVID pandemic only made things worse. Proposition 1 will finally change that by modernizing the state's mental health system to meet the needs of all Californians. Proposition 1 authorizes $6.4 million in bonds, that's not taxes, and directs billions more annually to finally fix our broken mental health system and move people permanently off the streets, out of tents, and into treatment. Democrats and Republicans support Proposition 1 because it addresses mental health and homelessness without raising taxes. What does a vote yes on Proposition mean, or what will does it intend to accomplish? First, Proposition 1 expands community-based services. That's community-based services. Prop 1 will expand mental health and addiction services across the state and serve tens of thousands of Californians each year. Secondly, Proposition 1 builds supportive housing. The initiative will create safe, supportive housing settings where Californians with the severest mental problems can live, where they can live, recover, and stabilize. Research suggests that the trauma of experiencing homelessness can cause people to develop mental health problems and worsen existing behavioral health challenges and coping behaviors. First responders and health experts support Proposition 1 because it provides badly needed reforms to the Mental Health Services Act by prioritizing housing solutions that get people off the streets and into care. Third, Proposition 1 provides treatment over incarceration. 1 in 3 California prisoners has a diagnosed mental illness. And today we spend over $100,000 per incarcerated person. And research shows it is costly and counterproductive. Prop 1 will prioritize treatment, not punishment for the mentally ill. Fourth, Prop 1 helps homeless veterans. It's a real disgrace that over 10,000 California veterans, many suffering from PTSD, are homeless and on the streets. Prop 1 will provide $1 billion to serve veterans experiencing homelessness and substance abuse issues. Fifth, Prop 1 addresses shortage of mental health workers. Currently, those with serious mental health issues can wait up to 6 months, and that's just for an introductory appointment. Prop 1 will help fund additional health professionals. Finally, Prop 1 requires strict accountability, and Prop 1 has strict accountability measures, including mandatory audits to ensure that funds are spent as promised. In conclusion, Proposition 1, treatment, not tents, will refocus billions of dollars in existing funds to prioritize Californians with the deepest mental health needs, living in encampments, or suffering from the worst substance abuse issues. It will create housing situations where Californians with the severest mental health needs can live and recover. And it will provide $1 billion to ensure our veterans experiencing homelessness, mental health, and substance abuse issues are given the care that they deserve. Supporters include first responders, mental health professionals, California veterans and organizations supporting veterans, and the California Chamber of Commerce. Choose compassion and common sense. Choose treatment over tents. Thank you.
Is this okay? Okay, I'm fine. Okay, I'm Stephanie DeGraff Hunt, and I'm speaking for the against it. So what would happen if we vote no? But I think the bottom line is, I just want to mention that there is an issue, and people have worked really, really hard on it. And as we've done our research, we've all been very, very impressed by how much has gone into this. It's just not perfect yet. So those are the things that we want to address here. So the key questions here are, how will Californians with behavioral health conditions be impacted? And what are the fiscal implications to both the counties and the state budgets if Prop 1 were to pass? It aims to support Californians. Prop 1 aims to support Californians who are most affected by severe behavioral health conditions, mental illness and substance abuse disorders, and homelessness. The restructure of allocations would increase housing support, but would adversely affect counties' abilities to provide their current behavioral health services. Counties would receive $140 million less in Mental Health Services Act funding, and would be required to contribute a greater percentage of the Mental Health Services Act funding towards housing, which about 1/3, which in turn would impact the access to mental health services that many Californians utilize already in their local communities. Approximately 1/3 of all County Mental Health Service Act funding currently used to provide mental health care services would be diverted into mandated housing expenditures with the proposition, or the passage of Prop 1. So for counties to be able to maintain their current mental health services, they would have to use or find other county, state, or federal money to make up the difference. The likelihood of this identifying new funds is simply problematic, and that goes back to the question that Janet raised. So again, just a quick recap on the Mental Health Services Act. It was in 2004, California's voters approved the Mental Health Service Act, known as Prop 63, which created the 1% surtax on personal incomes above $1 million to provide increased funding for mental health care services. That passage signified a commitment to improving mental health outcomes for all Californians, with a focus on prevention, early intervention, and community-based care. This tax supports about, like Janet said, 1/3 of the state's public mental health system. The 5 main goals: community services and supports, and that's huge. Prevention and early intervention, and then innovation, and then capital facilities and technological needs, and then the workforce education and training. Today, the majority of the Mental Health Services Act funding, 95%, actually goes directly to counties, all 58 counties, which have some flexibility in how to use these funds. 70% of the County Mental Health Services Act funding must be spent on community services and supports. 76%. 19% of the funds are allocated for early prevention. And 5% of the county funding is directed towards innovation and fostering different approaches in mental health services and treatment. And then under current law, 5% of Mental Health Service Act dollars is reserved for state level administration. So what Prop 1 proposes is significant revisions to the Mental Health Services Act, including changing its name to the Behavioral Health Services Act. So we got a new name. Then expanding its scope to encompass treatment for substance abuse disorders, as mentioned before. And it would significantly modify how funding is allocated and introduce changes related to oversight, accountability, and the community planning process, which has not all been ironed out. Counties would continue to receive 90% of the newly named Behavioral Health Services Act fund, but the allocation across different spending categories would change without an increase in revenues. Okay, so we don't raise the tax, but we're asked to do more. Counties would be required to allocate their Behavioral Health Services Act funds as follows: 30% for housing, 35% for full service partnerships. That's down from the 76% that's already currently happening. So that's like losing 41% of your income for those full service partnership programs. Then there's going to be allocated under the new Behavioral Health Services Act, 35% for health services and supports. So Prop 1 could provide some exemptions for counties with a population of less than 200,000, like up in our Northern California. During the first 2 years of implementation, there could be, as Janet mentioned, some flexibility in transfer of up to 14% of their funding between these three categories, but with a limit of 7% per category. And this flexibility is still pending for state approval, and it has not yet been confirmed. Another notable change is the Prop 1 would shift a larger percentage of dollars from the counties to the state from 5% to 10%, which means, again, the counties would lose $140 million annually redirected to the state budget. And again, this could be higher or lower depending on how our millionaires are taxed or how many millionaires we have. That has fluctuated over the years to a great deal, which again leaves for a lack of stability in the programs. So then, even at the state level, Prop 1 would at least would require 3% of the Department of Healthcare access and information to implement a statewide behavioral health workforce initiative. Then another 4% would go to the California Department of Public Health for population-based mental health and substance abuse disorder prevention programs. A minimum of 51% of those particular funds, that 4%, would be used for Californians who are under 25 years of younger. So doing all this fluctuation in people working together, that's something that people were happy about. It's worth noting again that Prop 1 would not change the tax on people with incomes over $1 million per year, which means counties would be expected to expand their scope of services without an increase of revenue, and that is just the biggest bone of contention. County leaders repeatedly have raised concerns about the disruption that Prop 1 would cause. Specifically, the restructuring would result in significantly less funding for core services. It would probably mean canceling programs and contracts with community-based organizations. It would close programs that are currently serving Californians and reduce county staffing. So there's all these fiscal impacts that are quite serious if Prop 1 were to pass. Again, the exact amount of impact will vary by county and depend on how much revenue is collected in any given year. I think it's really important to mention that the Mental Health Services Act services Californians of all ages for a range of conditions from mild, moderate to severe. And what the new program would do, the restructuring, would specifically target a subset of this population, which is more the people that have substance abuse and mentally health issues and that are experiencing housing or at the risk of experiencing housing. There's also a lack of clarity on how the new allocations fit into a comprehensive state plan. And then there's going to be administrative costs and time because of all the changes in administration. So it just kind of goes on and on and on. And you're like, oh my gosh. And I'm going to skip a part because you already said it. And I don't want to bore you all. But I thought it was really interesting. There's one of the issues that people are not supporting it are talking about the involuntary behavioral treatment, health treatment, and that has come up. So that's part of the care court system, which we heard a little bit about before. So again, it's all new and it's all yet to be worked out. Granted, there's almost $3 billion were being set apart for the voluntary and involuntary behavioral health treatment, residential facilities, to help get people off the street, which is what people want. They want people to have help. Again, it's the bond issue, the fiscal issue is just huge. The most recent cost estimate, like Janet said, is like $310 million a year and going up to $9.3 billion to repay the total bond. And that does not include the cost of inflation, so I would like to round it up. One thing here, this is the bonds is super important. While there are ways to equitably reform the state's budget's revenue streams, our policymakers have to balance the limited discretionary funds that are flexible in the general fund. When you have a general obligation bond like this one that's $6.38 billion, it's a big deal because the general obligation bonds prioritize increased debt service payments to be drawn from the general fund over any ongoing or one-time funding, such as the Mental Health Services Act. So the deal is it's a catch-22 here, because what happens is it's a trade-off that will reduce, it could very much, or the good possibility that it will reduce the flexible dollars left over from other vital services that are already being used to serve Californians with behavioral health conditions and of those at risk. So, and then it's just the ongoing consideration of operating costs. It's just going to be huge, and they don't really know, and the funds, it's just a huge problem. And then a key flaw is that it expands the scope of the Mental Health Services Act and prioritizes funding for people who are at risk of experiencing homelessness, which we've mentioned many times. But it just doesn't give us more revenue to do that, which essentially means that funds are being redirected from a program that was established in 2004 for a specific purpose, and now funds are going to be directed to a different need, to that subset group. Though, of course, there's a need to help those people. There's no doubt about the need to provide housing or mental health services. Policymakers, legislators, and all of us stakeholders have worked for years seeking solutions that will help increase both housing and mental health services. They are under fire to get things done, and we would like to see things get done. They've worked tirelessly. I just can't believe how hard people have been working on trying to resolve these issues. The consensus is that the intent of Prop 1 will have unexpected consequences and will actually set healthcare back in time. So I think it's time to reconsider the best ways to make positive changes in housing and mental care for all Californians. And Prop 1, as written, is not quite the perfect answer. Thank you. Sorry it's so long, but there's a lot of information.
We would like to take some questions from you if you have any. Can you let me get through what Judy? If you keep your questions general related to Prop 1, we are league members, we're not authorities completely on Prop 1. We've done some research, but it has to be general, so we're hopefully able to answer them. And we might not be able to answer some of the questions that you may have. Avoid expressing opinions, making statements, or telling anecdotes. And we may not have time for all the questions. Judy?
Did she have a list of who opposes, what organizations oppose?
Do you have a list, Stephanie?
I do. I have. This is from the pros and cons. Well, actually, from the legislative. Yeah, no, it's pros and cons. California Education Fund. The opponents, Californians against Proposition 1, are. Do you have that?
Let's see.
In all my papers, I have a lot of stuff.
Oh, there you
Well,
go.
there's a letter here. It's just a very long letter. There's the California State Association of Counties, the Rural County Representatives of California, the County Behavioral Health Directors Association, the County Welfare Directors Association, the County Health Executives Associations of California, and the County Probation Officers of California are organizations that have all written this 5-page, very cordial request to their legislators that they've been working with. So there are concerns. And
Yes.
it's also in the ballot, which I don't have right here.
Yeah. Yes, go ahead.
Someone told me during the break that I'm a League of Women Voters, that the League of Women Voters Study Committee has come out opposed to it. Why is that not being stated?
Because the purpose of the pros and cons, in order for us to be able to present the pros and cons like this, we are not going to discuss what the position of the League of Women Voters of California has taken at this time. We want to just present both sides and educate them as to exactly what the proposition does. Okay? And so we are required to basically state that and not to inform you that the League of Women Voters of California has taken an official position on this. So if you pick up our pros and cons that we're going to provide you as you walk out, it will not state that there is a position from the League in California at this
I
time.
don't understand that.
Yeah, well, this is
an educational form, not, because then it appears that we're only taking one side of the measure. And we're trying to educate so you as a voter can decide, looking at both sides, how you would vote on this proposition.
And we've studied a lot of things, and all I can say, it's really, really complex. The proposition is very, very long.
Yes. Yes.
You know, this whole program in the legislation obviously comes down to funding interventions, right? And how those funds are distributed and what the different interventions are. Is there anything in the legislature that says we want to know what the outcome of the interventions are? Which interventions are more effective, and can we get that information? Because certainly there's a huge number of treatments for housing, a certain number of treatments for addiction of different kinds, but what you'd like to know is what the most effective intervention is.
Yes. I was just quickly looking through there is in Prop 1 discussions of how the counties provide services and how they'll report out. So there will be a different level of reporting than they do now under Prop 1. I mean,
But my point is, are they saying which one is more effective? They're reporting, yes.
In the legislation, in the proposition, they talk about different programs that they want to see the money spent on that are different than in the Mental Health Services Act.
That's
So there,
correct.
it's,
What are the outcomes? There's no.
I never read the word outcome in anything
They
that I
don't
read.
even ask the question. They assume that if you provide an intervention, that in some ways it works. And I don't know how you determine that.
And I don't know how to answer that.
Well, all I'm pointing out, and it may not actually be part of this bigger thing, but I think it's one of the things that we would like to have our legislature do is not only have interventions, but have a report of what is the most effective intervention or whether it was effective. That's my point.
Thank you.
You're quite right in that it doesn't mention it. And I think that's, you do an intervention because you want an outcome, and you want a positive outcome, and we'd like to see that.
Thank you.
Can you just clarify how it works? It sounds like the state takes money from the county and then allocates it back, but the counties are still responsible for building the treatment facilities and the residential facilities at a certain
Yes.
level. So it's disaggregated funding that goes to all 58 counties, but not necessarily in the proportion that they provided it to the state.
Yes, so basically, right now, under the MHSA Act, which is, name is changing, they receive 95% of the funds. This measure changes that to 90%. Of that 90%, 30% has to go for housing, which the county is responsible for ensuring gets constructed. Or utilize renovation of a hotel, motel, or other buildings. Other questions? Yes.
I believe the SB 326, it's called the Modernization Act. What I'm hearing, generally speaking, in the description is that we're going back to the 1950s and putting more people in involuntary care, essentially incarcerated and mentally ill, and to eliminate the innovation programs from Prop 63 or the Mental Health Services Act. Is there something in the pro that explains exactly what's being modernized?
I can't answer that. And Pat, do you want to?
I'd like to respond to that. I think that modern health care, mental health care, is not going to go back to the 1950s. I'd like to think that they progressed exponentially over time, and I think that they know how to handle patients in a just whole different manner. I don't think we'd be going back to forced incarceration of people. It won't be like that. That's my opinion.
Lauren?
On the macro level, it appears to me that the state has decided that in the 10-plus years since the MHSA has been in effect, that the counties haven't lived up to its expectations. Therefore, the state has said, we're going to tell you counties what to do. Is that fair to say, or am I misunderstanding that?
In all the stuff that I read, I didn't see that come across as more of trying to address with the issues of mental health, the issues of housing.
Okay, thank you.
And I think that's a fairer way of looking at it, that if you're gonna provide housing, you gotta have money. Well, there's a pot of money here. The legislators looked at that and said potentially that could be another way of solving that. So I think that that's trying to balance issues. And I mean, in looking at the number of people that are homeless, that are also suffering with mental illnesses, they saw this as a way to look at that from a legislative standpoint. And remember, this is a legislative introduced proposition. And I think it's important that you understand that. because it takes on a different than citizens going out trying to get signatures on it.
And Lorna, it sounds like they're gonna build a lot of housing, but actually the impact of that on reducing homelessness is only 3%, which is just so sad. Because I know everybody has a good intention at providing people that are experiencing homelessness with places to live. But again, that's that subset piece that the state would be mandating counties to look at. And those are, so many of the people that are homeless, what's the percentage of them having ongoing mental illness is very high. And so ideally, but having housing would reduce that. So that's the intent, I think, behind this, which would be great, it's not enough.
Can I ask just a follow-up? I think that's an interesting point. So I think the pro side would say that the housing is beneficial to the measure, but I would say the con side makes a con argument that the housing causes other issues. Could you maybe elaborate on the housing solutions that the different sides are saying are the reasons why the measure is coming forward?
I don't have any information in anything that I've read about that at all.
I would say that if you look at the proponents of the measure, it is really housing driven as a way to address many of the mental health issues. And on the con side, the issue that I've seen is even if you spend all this money, you're not really solving the homeless issue. And so they both have, so that really gets to the issue. Does that help you? Yes, Faye.
So, the money that's being spent on housing, is that purely for the infrastructure, the physical infrastructure, or also for like the training that you would need to conduct with the people going into the housing and the care or the supervision or whatever you want to call
So
it?
I
while
stated
they're living there.
I stated in my report, it was very clear in almost everything I read, that while you are allocating money and out of the bond, you would get potential money to help build the housing. That would go to cities and tribes. The cost of services like counseling or other things would still probably have to be borne by the local government or the tribe. That there wasn't money dedicated to the full cost of doing like permanent supportive housing. It was to get the construction made or renovation made or what you need to do to provide the housing. But it specifically states, and almost everything I read, that there still are additional costs to be borne by the local government and the tribes for providing for the services that they need to accompany the housing. Which is fairly typical for dealing with providing housing right now, even for permanent supportive housing if you got state money to build it.
I didn't read this part, but let me read this part because the funds that can presumably help sustain facilities that are projected to be secured through the bond funding. So in other words, yes, we build them, but how do we sustain them? That's not answered yet. And however, it is uncertain whether these funds and those from other sources will be sufficient and accessed efficiently to ensure adequate upkeep and staffing and proper care for the Californians receiving housing and services through these projects. So it's just, we basically want to do more things, but we're not doing it with more, we're not putting more money towards it.
Other questions? Oh, okay. Do you want me to thank you?
It's time to go home.
We should thank Woodland TV for their broadcast and recording of the event. The City of Woodland for the use of the Woodland Communities and Senior Center and generous assistance from the staff. And the volunteers, Pat and Stephanie and, that's okay, I like doing this. So, and thank you to Carla, who goes to the work of all putting this all together in the PowerPoints. And this is not even her position. She's the treasurer of the Woodland League and stepped in to help us with water service. So, and the Davis League people that worked on this and the Woodland League people. It took several people to put this together to make sure we could provide an educational forum for you. So, and thank you for coming and listening. And just look at our websites, and there are upcoming events for both leagues, and look to the websites to find out more information. And I hope you've received this, so you didn't have to take notes this evening. A lot of the information is in here for you to take, and thank you very much.
Want to thank you, folks.
Well,